everyone, my name is Brianna. If this is your first time coming to my channel, welcome. And if you're a returning subscriber, welcome back. I've actually been trying to figure out how I wanted to make this vlog for you guys because it's kind of hard. So, okay, let me backtrack. I am in my mental health and community health clinical rotations right now, and these are a little bit different from other clinical rotations that I've been in, especially community health, because for my group, we're not actually in a hospital setting. We're actually in the community, in people's homes. So I can't do any recording because we can't record in people's homes. You know, it's invading their privacy, and y'all don't want to invade no privacy. And then for mental health, we can't even take our phones into, well, we can take them into the facility, but we can't take them on the mental health floor. We have to lock them up in lockers. So it's been really difficult. Like, I have no idea how this is about to go. I'm just winging it at this point, but I wanted to give you guys some kind of insight on how these clinical rotations go. So today is my community health rotation, and then tomorrow and Friday are my mental health rotations. So I'll probably just take you with me parts of today and parts of tomorrow as much as I can, explaining as much as I can. So yeah, I am about to get out of here right now. I'm already dressed, and it's like 8, I think. I don't know. I have to go meet with my preceptor, so I'm getting ready to get out of here because I know I want to get some Starbucks before I leave. Y'all know me and my Starbucks. I gotta have my Starbies. So I'm about to get all my stuff and get out of here so I can make sure I get my Starbucks before I leave. So let's get out of here. Okay, so since I'm waiting in the drive-thru right now, I guess I can talk a little bit about how this community health rotation is going. So there are different groups based on the CRN and stuff that we signed up for registration. There are some groups that are in a hospital setting, some that are in a vaccine clinic setting, but my particular group is in the home health setting. So we go around to different people's homes, and we actually don't really see each other. We saw each other last week to do post-conference, which I'll go into in a little bit. But yeah, we are paired up with individual nurses, so we each get our own nurse to follow around for the day. There are some nurses that allow you to ride with them in the car as they go from house to house, and there are other nurses that want you to drive your own car to each house. Fortunately, my nurse lets me ride with her, so it works out because gas is expensive, okay? I don't like spending all my gas money going from place to place like that. I don't. So what I did last week, I got to my nurse's house around 9:30 in the morning. Oh, that's another thing. The nurses pretty much determine your schedule for the day. If they get up at 8 o'clock for their appointments, and you go with them at 8 o'clock. If they go at 9:30 or 9 o'clock, you go with them at 9, whatever those times are. Different nurses do different things, but you're pretty much following them around for the day, seeing what they do in the patient's homes. My nurse, last week we went to 4 homes, and then after she finished those, she did an extra home at the end. I was able to see wound care stuff. I was able to see IV preparation stuff, and it's a lot of patient teaching. If the patient doesn't know how to do something, then you teach them how to do it. And it's important because these patients are not patients that are in a hospital setting, so they're not being watched while they're there the whole time, nothing like that. Once the nurse leaves their home, until a nurse or another medical professional shows up to their home, they're responsible for their care. So they need to know what to do when nobody is there to help them so that they can properly take care of themselves. So yeah, we went to 4 homes. I saw a lot of different things. Like I said, a lot of wound care stuff, a lot of IV stuff. And then the last home at the end actually showed me the process of how they get started with home care. So it's like a lot of paperwork and the patient's medications, figuring out what it is that they need, what resources they need, and then directing them to those resources so that they're able to get them. Oop, hold on, I'm about to pull up to the window right now. All right, I got my frap and I got my sandwich, so all is good in the world. But what was I saying? Oh yeah, so after we did the appointment with so I want to talk about, so each appointment, the nurses are required to have, like, to meet with the patient for at least 30 minutes. And then the appointments that have, like, the startup care, so, like, starting up with their, like, insurance, getting their insurance information, their medication information, and all of that, those pretty much last however long it takes until you get all of the information you need. So each of the appointments, the 4 appointments that I went to last week, were about 30 minutes long. And then that last appointment was like an hour and 15-ish, I believe. It was pretty long. So I was sitting in there for a while. But you get to know the patient. So community health, you get to, like, know the patients on a personal level because you're seeing them on a consistent basis. So that could be once a week, it could be twice a week. It's pretty much, it depends on how much care the patient needs from you. So you set up a schedule with them, tell them you're going to meet them on this day and time, and then that's pretty much it. You go from there, help them out, and then you see them the next week or whenever they're next scheduled to see you. So yeah, after all of the appointments are over, my clinical instructor has us do post-conference. So what that is we meet up some kind of way, either in person or on Zoom or whatever. We talk about how our day with our nurses went, what we learned, all the stuff like that, and then we pretty much go home. So community health has been really chill. Now keep in mind, I've only been doing it for a week. This is my second day with community health, so I'm gonna see how today goes, and then I'll let you guys know if, like, there's any changes or any updates or anything like that. But yeah, I'm going to put my phone down because I am driving and I don't have one of those little things I can stick on the car because I need to get one, but I need to find a good one. So I'm gonna put my phone down and focus on driving. My nurse lives 35 minutes away from me, so I have quite a drive to make. So I will check in with you guys when I get there, and yeah, bye. Why my nurse just asked me to meet her at 9:30 instead of 9 o'clock, and I'm already on my way down there, knowing it takes me over 30 minutes to get to her. So with me having 30 minutes to kill, I decided to drive around the city a little bit. Last week, my nurse showed me, like, different spots where I could find some water, but look at what I stumbled upon, guys. It is so beautiful. Like, I am obsessed. Like, I found this place by complete accident. I was looking for something else, but I found this instead. I wouldn't want to spend my 30 minutes doing anything else. So I'm not even gonna complain that I still had an extra 30 minutes because this is, like, it's beautiful. So I am going to enjoy this for a little bit because I do still have to meet her at 9:30. So she only lives like 8 minutes away from here, which isn't far at all, but I still have to drive back. So I'm gonna enjoy this for a little bit and then we're gonna head back. I just realized that one of the downsides of doing this community health rotation is the issue with the bathrooms. I'm not using the bathrooms of the patient's homes. So last week I literally held it for, what was it, 6 hours? I had to hold it for 6 hours and I should have found a bathroom right now. I wonder, I got 4 extra minutes and I just drunk this coffee drink. I should go find a bathroom before I get to her house. Let me see if I can find one. If not, I'll just have to hold it again. It's fine, but okay, let's see what we can do. Luckily, there's a Walmart like right next to her home. So I'm gonna use this and then we're gonna go right down the street. There's no lock, whatever, it's fine. Okay, I feel a lot better. According to my GPS, I literally have 1 minute to get to her house. But it's also, according to my GPS, she only lives less than a minute away. So we're gonna get out of here now. Okay. Okay, so I am done for the day. My nurse got done with her appointments early because somebody canceled, and then somebody just was not answering their phone. So she's calling multiple times and they're not answering their phone. There's not really anything you can do. So I am on my way home right now, and oh my gosh, guys, I had such a good day. Like, today was such an interesting day, and I learned so much new information today. So I'm gonna hurry up and get home, and then I will let you guys know how my day went. So I'll tune in with you guys in about 33 minutes. Whew, y'all, I done got home and forgot that I was vlogging. I had to go and get myself dressed and get my makeup and stuff done because I'm going to my friend's going away party at 5:30. Hold on, somebody's calling me. Okay, so like I was saying, how my day went. So it was very interesting. The first appointment that we went to, it was a wound patient. He had a wound on his back from getting spinal surgery. So the surgeon for the procedure ended up leaving the wound open to like close on its own. And it had a wound vac attached to it. So my nurse showed me how to, it's a process to like get a wound vac together. So like you have the steri strips, you have the like tegaderm strips, and then you have the sponge. Like the sponge is huge. It's like a big black sponge. And you have to first like make sure that the area is clean on the wound. And then you have to cut the big sponge to fit the shape of the wound, so that there's no like any like way to get any kind of infection or anything from the wound back into the wound. So it was interesting like watching her do that whole process of like getting his wound dressing together and like attaching the wound back to the dressing and everything. So that was really cool to watch. And she was letting me know that if you have an issue with the wound vac, you need to turn that off as soon as possible. Just put a wet to dry dressing over it until it's able to be attached back to the wound vac. And you cannot leave the wound vac on the wound, like when there's an issue, for more than 2 hours after the issue has been like, after you've seen that there's an issue, because you can get an infection or something even more serious. So I learned a lot about that. And then we saw 2 more patients, and with one of the patients, which was the last one that we went to, I got to hear a bruit for the first time. And when I tell you, it was so cool. So like it was a bruit and a trill. So the bruit is the sound that you hear, and a trill is what you feel. So she had a fistula on her arm from getting dialysis, and she was like, do you want to listen to the bruit? And I'm like, yeah, like that would be cool. So I listened to it on her stethoscope, and it is so cool. It's so cool. Oh my gosh. And that same patient had a murmur. So she was like, when she was like listening to her heart and everything, she's like, do you want to listen? And I'm like, yeah. Like I used to have a murmur when I was younger. So it was I guess she called it a congenital murmur. So I had one of those when I was younger. So I thought it would be cool to like hear what a murmur sounded like. So I put her stethoscope back on and I heard the murmur, and it was a mitral murmur. And it was, when I tell you, like, there's so many cool things in healthcare and medicine, like that you don't know about. Like I learned something new literally every day, and it's amazing. Like I love the field that I'm going into right now. So yeah, my day was fun. My day was interesting. I love the nurse that I am supervising, that I am watching every single day. I love her. She's just a couple years older than me, so we relate to a lot of stuff. So yeah, I'm really enjoying my clinicals with her. So yeah, I've been talking for a minute. I'm about to relax for a little bit. I have to wait until 4 o'clock. It's 3:30 right now for our Lord, why did I just blank out on the word that we call it? It's like a wrap up of our day, letting our clinical instructor know how our clinical went for the day, what we learned, anything like that. So I'm waiting until 4 o'clock for that, and then I'm going to go ahead and get ready to head out to my event, which I'm so sad about because I don't want her to leave. But yeah, so I'm gonna wrap up the vlog for today, and I will see you guys tomorrow. So see you then. Good morning, you guys. It is Friday at 6. Let me turn this down real quick. Okay. It is now Friday. It's 6:22 in the morning, and I can't talk this morning, goodness gracious. And I'm on my way to my mental health clinical. So yesterday I did not vlog. I was gonna do the mental health vlog yesterday, but like I told you guys, I went out after clinical on Wednesday to celebrate my bae moving to Houston. So we had a long night. I'm not even about to lie. Yesterday was rough. I was tired, I was exhausted, and I just did not vlog. So luckily this mental health clinical is 2 days, so I get to still like give you guys like footage and stuff from today. I've been up since like 4:45 this morning because I was packing because I'm going to my parents after I leave clinical. And unfortunately, I didn't leave early enough to get me some coffee or anything to drink. So I don't know how this morning is gonna go, but I'm optimistic. I'm so happy. I'm grateful that God woke me up to see another day. So I have no complaints at all. So yeah, it's like raining really hard and I kind of want to focus. So let me check in with y'all when I stop my car. So one of the things that I love about this clinical site is that it's literally 6 minutes away from my apartment. So yeah, I'm already here. I'm about to park my car. I'm getting in there right at 6:30, so I was definitely pushing it today. But you know, sis made it. It's raining out, like it's Friday, like it's not a big deal. So I am pulling into the parking lot. Whew. Okay, so I'm about to walk in. Luckily, this is all I literally need for this clinical. Like this clinical is like a real chill one. I don't have to really bring my backpack or anything. We really only need our clinical packets and a pen and a piece of paper because like if we want to take notes or anything like that. But for mental health, we don't touch the patient, so we don't do vitals, we don't do like a health assessment. We're pretty much just looking at how they act. It's all like mental health, duh. Like, so we're looking at their mental diagnoses. So yeah, we're not touching the patient, so we don't need our stethoscope or anything like that. We're just paying attention very closely to the patient and what they're doing. So I'm literally walking in here right at 6:30, and I still have to walk through the hospital, go up the elevator, and then meet everybody on the floor. So it's been a rough morning, but like I said, I'm happy, I'm blessed, I'm grateful. So let's get in here. Oh, we had to do this like entry thing where we have to scan this little barcode I have right here, and then it pops up like a questionnaire for like COVID related stuff, which I already did in the car. So I sped up my process a little bit. So yeah, I'm about to go in right now and we'll see what happens next. Y'all know I don't mess with elevators. Lord. If it weren't for this, I would be taking the stairs, but they have like stairs nowhere. But yeah, like I said, I can't take my phone on this mental health floor, so I'm gonna have to put it in my locker. So as soon as I get time to get my phone back out, I will tune back in with y'all. So see y'all later. So we are on a little break right now. I thought it was really nice because our instructor brought us donuts today for being such a good clinical group, which I love because I got an apple fritter and it was delicious, but also because he's been a really great clinical instructor. I know a lot of other groups in our cohort have not had as lucky of an experience as we have, so we're blessed to have our clinical instructor. He's been great the whole entire time. But our morning has started out really good. We had an interview with one of the patients. We just let her talk about whatever she wanted to talk about, and we were able to pick up on some things based off of her diagnosis, so that was really interesting. We actually did a lot of interviews yesterday too. We did one-on-ones with a couple patients, which was really nice. But yeah, we're taking a little break, and then we're gonna go back upstairs. We're gonna do rounds on the floor, so we have to go up and down the floor every 15 minutes for an hour and document where the patients are, what they're doing, and everything like that. There are 18 patients today. There were 16 yesterday, but they got a couple of new admits when we left yesterday, so we got a couple new ones that we have to associate with their names with their faces and everything. So we're gonna get to know some new people. But yeah, it's been a good day so far. It is 8:34 right now, so it's just been a couple of hours, but we've already done quite a bit, so we got some hours to go. We're gonna finish this break and then I'll check in with you guys later. All right, and that is it. I am done with clinical for the day. As you can see, I am driving. I'm on my way home right now to go see my parents, which I'm so excited about because I haven't seen them in so long, and my baby sisters. So I'm on my way home, but yeah, clinical was great. Like I said, we didn't do a whole lot today. Is this traffic? I do not like traffic. Like, that's the one thing it's my pet peeve. I can't stand traffic, y'all. But yeah, so we did rounds. So like I said, with that, you just make sure all the patients are accounted for. You mark where they're at, what they're doing, if they're awake, if they're asleep, anything like that. We did that, and then we worked on our clinical packets, and then we went home. So that was pretty much it. It was a pretty chill day. There were a couple of us that did get to sit in on a group. I was doing rounds at the time, so I didn't sit on the group, so I'll sit in one before the semester is over. But it's nice that we're given the option to be able to sit in one of their group sessions to see how they go. Also, I love how we're like starting to form relationships with some of the patients, because we'll come in and the patients will say hi to us, they'll ask us our name, ask us questions about ourselves. Like, they're starting to become very comfortable with us, and I love that because that's all we want is to make them comfortable, make them feel open to like being around us, trusting us with their information and with them and everything. So it's been really nice. It's a really nice experience, and it's something that I was not aware of until this clinical rotation. So yeah, I'm blessed to have this clinical group, to have our clinical instructor, because a lot of our cohort did not get the same opportunity. So yeah, I'm loving this experience. So yep, I'm on my way home, and I think I'm going to end the vlog now. If you guys have any questions regarding clinical, regarding the mental health rotation, the community health rotation, or anything like that, any questions in general, go ahead and ask them in the comments for me, and I'll answer them for you. And I will see you guys in the next vlog. So I hope you guys have a great rest of your day. Don't forget to like, subscribe, do all of that good stuff, and I'll see you in the next vlog. Bye.